This video is about stuttering therapies for preschool children. If you like these videos, please buy my book, Making Stuttering Therapy Work, on Amazon. Now I'm going to talk about Wendell Johnson's indirect therapy. Wendell Johnson developed the diagnostic theory of stuttering in the 1930s. He believed that parents cause their children to stutter. And he developed indirect therapy to treat childhood stuttering. The child does not participate in this therapy. Instead, the parents change their behavior. Now, this has become very popular. You see this all over the internet. For example, kidshealth.org advises parents to provide a calm atmosphere in the home, try to slow down the pace of family life, speak slowly and clearly when talking to your child or others in his or her presence. The Johnson's theories have become especially popular in recent years, with a movement among parents to pull their children out of speech therapy on the belief that speech therapy makes stuttering worse. Well, let's take a look at the evidence. In 1995, a literature review of 13 studies found indirect therapy to be ineffective. So the reviewers found, quote, little convincing evidence that parents of children who stutter differ from parents of children who do not stutter in the way they talk with their children. Similarly, there is little objective support that parents' speech behaviors contribute to children's stuttering, or that modifying parents' speech behaviors facilitates children's fluency, unquote. A 2007 literature review repeated the 1995 literature review's conclusions that indirect interventions are, quote, not effective by themselves in eliminating the problem, unquote. The review concluded with a warning that, quote, the complexity of input language is a very potent predictor of children's later language profiles. Greater sophistication in parental input language is positively associated with children's language proficiency, unquote. In other words, dumbing down how you talk to your child might achieve nothing but dumbing down your child. Now I'm going to talk about the LIDCOM program. The LIDCOM program was developed in Australia, and in this program, it's direct therapy. And in other words, the parents are doing something when the child talks. And the other interesting thing about LIDCOM therapy is that the therapy is provided by the parents. So the speech language pathologist trains the parents to provide the therapy. So the parents can verbally reward a child's fluent speech, like saying good talking, and the parents can ask the child for self-evaluation, such as asking, was that smooth speech? And the parents can also actively correct the child's disfluencies by repeating the child's words fluently, or asking the child to repeat words fluently. Now, at least 8 published studies have found the LIDCOM program to be effective. The point of LIDCOM was it's a very simple therapy. It's so simple that the parents can do it, with the idea that parents doing therapy every day can be more effective than a speech language pathologist doing therapy once or twice a week. But simplicity is Lidcombe's strength, but it's also its weakness. So the Australian Stuttering Research Center developed another more complex therapy called the Westmead program. So in the Westmead program, the speech language pathologist trains the child to speak at a slower speaking rate. And this study found that this was effective with preschool children immediately and after a 12-month post-treatment follow-up. Okay, I'm going to end this this video by talking about two therapy games parents can play with their children. So in the game Turtle Talk, the speech language pathologist makes a turtle hand puppet walks slowly while a child uses slow, relaxed speech. Then when the child uses fast, tense speech, the turtle stops and crawls into its shell. The child uses slow, relaxed speech to ask the turtle to come out of his shell. So if you don't have a turtle hand puppet, you can have a car drive slowly along a table, avoiding obstacles. Now the other game is called Say the Magic Word, which the clinician or the parent tells the child that he or she is thinking of a word, and if the child guesses the word, the child will be rewarded with a peanut or will be allowed to ring a bell. So then they look through a picture book, or they look out a window. So this game is easy to play while the parent is driving with the child. So when the child says a word fluently, the parent says that was the magic word and rewards the child. If the child stutters, he isn't rewarded. So in other words, the parent isn't thinking of any specific word, but rather the parent is listening for the child to say fluent words. Okay, so that's the end of this video about stuttering therapy for preschool children. Look below the video for a link to buy my book, Making Stuttering Therapy Work. And you can look for a button to click to watch the next video. If you're watching this on YouTube, please click the like and subscribe buttons below the video so that I get a share of the revenue from the ads you've seen. And lastly, my website is casafuturatech.com.